Good evening, and thank you for joining us via Facebook Live tonight. I'm Brian Morgan, Secretary for Queen City Omegas and host for tonight's event. Mental health awareness for Mecklenburg County and surrounding counties. Tonight, we think we have a great program as we discuss the varying impacts of COVID-19 and coronavirus in the Black community on several points. First, I must note that in accordance with CDC and State of North Carolina guidelines, we will maintain 6 feet of social distancing during this discussion. In addition, face masks have been provided to all the panelists and the moderator. According to the CDC, Blacks represent nearly 30% of all COVID-19 infections and nearly 1/3 of all deaths. Meanwhile, we represent 13% of the total US population. We've heard the reports in the news, and we want to dig deeper tonight. In North Carolina, we as a community represent 37% of the COVID-19 cases versus 22% of the total population in the state. A recent Washington Post opinion article from May 13th by author David R. Williams noted pandemic stress was having a profound implication on African American mental and physical health. And it will persist long after social distancing and the coronavirus has been contained. So the Queen City Omegas believed it was our obligation to hold this event and begin the dialogue regarding these physical and mental health impacts that are not only impacting the nation, but especially Mecklenburg County and the state of North Carolina. Our moderator this evening is David B. Sanders, and he will lay out the format for the program. But I would like to note during the Q&A portion of this event, we will attempt to take questions live via Facebook. So please ready any questions you have for the panelists as we move further in the program. We would like to thank our community partners for tonight in helping us put this together. Mental Health Americas, the C.W. Williams Community Health Center, V101.9, East Stonewall AME Zion Church, which we are currently Facebooking live from, and MGR Video Pro, who has helped put together this program and give us the ability to be on Facebook Live this evening. One last note I want to make. You can make a donation to our community partner MHA by texting MHA40 at 71777. Again, MHA40 at 71777. As MHA does a great job in the community in terms of working in helping assist around mental health and the impacts. Before we proceed, I want to bring up Brother Perry Caudle from the Pi Phi chapter for a few more brief comments.
Thank you, Brian. Tonight is truly a special event. Through the hard work of Brother Brian Morgan and his committee, he has assembled 5 subject matter experts in the area of depression, domestic violence, and child abuse. We are so grateful and thankful that they have taken the time out of their busy schedule to share with the Charlotte-Mecklenburg community very, very greatly needed information as we all navigate through this pandemic. So thank you. And on behalf of the members of Queen City Omegas, look forward to our next event where we will tackle mental health as it affects our true heroes, the veterans from our service academies. Thank you and enjoy the evening.
Thank you, Brother Caudle. So as we move forward in the program, I did want to make 2 biographical introductions. One for David Sanders, who will be the moderator for this evening, And then 2, introduce Raynard Washington, who is the Deputy Health Director for Mecklenburg County, and will give us some in-depth knowledge in terms of how the coronavirus and COVID-19 is impacting our community. First, David Sanders. He's a life member of Omega Psi Phi fraternity and an active member of the Pi Phi chapter here in Charlotte. He is the current Omega Man of the Year recipient and the past recipient of the Superior Service Award for the 6th District of Omega Psi Phi. Brother Sanders is now retired, but was a senior human resources consultant with the City of Charlotte's Human Resources Department. In addition to his regular duties of addressing human resource issues for client managers and department needs, he facilitated training classes and served as a mediator and a mentor. He was also an instructor at CPCC in the Corporate Continuing Education Division. In addition, he has served or is currently serving on too many boards to mention at this time, but he is an elder at Greer Heights Presbyterian Church. Brother Sanders holds a BA degree in psychology and a master's degree in education, and is married to Jacqueline Stevens. They have a son, Ian, and a daughter, Amani, and 4 wonderful grandchildren, Paz, Anderson, Noir, and Miles. But immediately, I want to bring up Raynard Washington to talk about COVID-19 and coronavirus in the community. In his current role, Dr. Washington provides guidance for internal operations and direct oversight of several areas of Mecklenburg County Public Health Department, including fiscal operations, compliance, strategic planning, and epidemiology. Prior to joining Mecklenburg County Public Health, he served with the City of Philadelphia and Federal Agency for Healthcare Research and Quality. As a public health leader and administrator, his work is focused on understanding and addressing health inequalities among the most vulnerable communities. Raynard Washington earned his undergraduate and graduate degrees at the University of Pittsburgh. I'll now turn over to Raynard Washington to talk a little bit about what we're going through right now with coronavirus and COVID-19.
Well, thank you. It's certainly great to be here with you all this evening, and thank you to those who are joining us online. We're certainly happy to have a great discussion, hopefully, tonight about some of the impacts of COVID-19, not just on the Black community, but on communities who are vulnerable in many other ways across the county. So just to provide a really quick update on what's happening with COVID-19 here in the county, I do have just a few slides I'm going to talk through, and again, look forward to any questions and discussion later. So moving to the second slide on the deck, things are changing really rapidly with COVID-19 here in the county. We continue to really see the situation evolve in real time. As folks probably have noticed or have been informed that we are moving, and we've moved in now into the modified phase 2 of the governor's reopening plan. And what that really means is that we have loosened the restrictions a little bit on individuals being able to go out and access some services and some businesses. But it doesn't mean that COVID-19 is gone. And so we have recently been under a stay-at-home order, which really allows us an opportunity to not get rid of COVID-19, unfortunately, but it allows us to slow the spread of the virus in our community and really across this country. And so it's still with us, and it's still in the community, and it's still spreading in our community. And so we ask everyone to remember to be very vigilant in their actions and activities, to minimize their out-of-the-home activities, to remember to wear a cloth face covering when you go out, and social distance is hard to do. I don't have to have this on now because we're appropriately 6 feet away, but I'll wear it for the symbolic purposes of it. And also to remember good hygiene. So basic practice of good hygiene. Wash your hands, wash surfaces, don't touch your face. And the last thing I'll say is to ensure that you keep 6 feet away when you are in public or with other people. And to be kind, to check on each other and to continue to maintain social communication while we have to be physically distant. As I was saying, the situation continues to evolve. And so we are monitoring at the health department really, really closely what's happening with COVID-19 in our community. We have a number of key indicators. I'll talk a little bit about some of them, not in great detail, but just to give you a sense of what we're keeping an eye on as we continue to monitor this active situation in our community. This pandemic is still occurring. The slide you see in front of you shows the current status of things in terms of case counts and deaths in Mecklenburg County. Unfortunately, this data is now old. This was just as of yesterday, but as of today, we do now have over 3,500 confirmed cases of COVID-19 in Mecklenburg County. I believe the exact number is 3,530. We also have had a number of deaths, unfortunately, and our thoughts and prayers go out to those families who are grieving. As of today, there are 86 deaths due to COVID-19 among Mecklenburg County residents. We do have a number of long-term care facilities and residential facilities that are congregate living settings that are particularly vulnerable to viruses like COVID-19 that are experiencing outbreaks in their facilities. And so we continue to work very closely with those institutions to really protect and care for the most vulnerable in our community. Moving on to the next slide in my deck, you see here a number of graphs. You probably can't read very closely. But the point of this is to really show what we're really focused primarily on right now is understanding and monitoring the trends. As the virus is continuing to spread, and we're starting to see some uptick in a number of key indicators like the number of folks who are in the hospital due to COVID-19, the number of people who are diagnosed every day, the number of people who, the proportion of those individuals who get tested that are diagnosed. As we scale up testing, we know we will continue to have folks who are tested positive, and we'll have more people as more people get tested and tested more widely available. And also monitoring the number of individuals that die every day. And those kinds of trends allow us to understand what's happening in real time as it relates to the epidemic. Because the virus has a fairly long incubation period, any activities that happen really take about 2 weeks for us to be able to see what's happening. And so as we've now finished phase 1 of the governor's reopening plan, we are looking very closely at the impacts of that initial loosening of activities and looking to see what happens as we move forward ahead. You can move to the next slide. Here in Mecklenburg County, we have, in addition to understanding and monitoring our trends over time, we are looking at disparities. We're trying to look and watch very closely to see which communities and which populations of people are being impacted differently, where are spread happening more widely, where individuals are having greater complications or morbidity or hospitalizations due to COVID-19. And that's really important for us as we think about how do we take action to respond to those differences. This is now a map on the screen, I believe, if we're on the slide, of Mecklenburg County. And you can see this is actually a per population or a per capita rate of COVID-19 cases by the zip code where people live, the residential zip code of their homes. And we're starting to see, again, some clear differences by neighborhood and geography in the number of cases that are confirmed positive. We are watching this really, really closely. Some of this is driven by increased testing in some communities. Some of this is driven by increased population density in those communities. But it's really important for us to keep a close eye on those areas and understand exactly what's happening. In addition to this, we've seen a number of disturbing trends early on in this epidemic here in Mecklenburg County, where we have seen disparities in terms of the number of cases that are people of color, the number of deaths that are people of color, and we continue to work very closely to monitor those things. So as Brian just mentioned, moving ahead to the next slide, COVID-19 and a number of health conditions do disproportionately impact communities of color. And one of the reasons that we know for sure that is happening is because of the underlying disparities and opportunity and equitable access to things that make living a healthy life easy. But there are a few key things that I just want to point out about why COVID-19 is impacting the African American community differently than some other communities, and really sort of make sure that we're all clear about why we see these inequities. The first thing I'll note is COVID-19 does not seem to be impacting our communities differently because of some differences in our genetic makeup. It's not related to viral susceptibility because Black people are more likely to get a virus, et cetera. It really is a myriad of other non-genetic factors that we believe to be creating the inequities that we see in COVID-19's impact on us. And that includes things like higher rates of chronic illnesses and earlier onset of chronic illnesses, which is really important to acknowledge. And those chronic illnesses like diabetes and hypertension, obesity, chronic obstructive pulmonary disorder, and asthma all make you at greater risk of complications of COVID. And individuals who are at greater risk of complications are more likely to be hospitalized. Those individuals are more likely to need additional supportive services. Individuals with those chronic illnesses, their bodies are also more vulnerable to infection and more complicated infection. And so because our community has more rates of these conditions due to a lot of reasons, we in fact are more susceptible to the sort of more severe impacts of a virus like COVID-19. The second thing is a practical issue. People of color more likely work in essential jobs, so either in healthcare jobs, or they may potentially work in food service, or they might work in a number of construction. They could work in a number of transportation services. And if those individuals who are not at home teleworking and are actually in offices interacting with the public are certainly at a higher risk for being impacted by a viral disease that's respiratory. And so that certainly has an impact on the overall population level estimates for our communities. And the last thing that I'll point to that all these things lay to is that the underlying disparities in access to care and access to affordable care and access to healthcare resources and other resources that make living a healthy life easier, these inequities that are driven by poverty and economic disparities certainly do show their real truths in times like these when we're dealing with the pandemic. And so those are some of the key reasons why we see these disparities, and I just want to make sure that that's clear with everyone. So the next slide talks a bit about solutions and what matters and how do we actually do something about this in the pandemic response. And so there are a number of things that we're doing both at the county level, the city level, and across the country really to do a few things. One, raise awareness, but also to address the issues. And so the four things that I'll just point out really quickly before I take my seat is we are, of course, implementing measures to slow the spread of the virus, and that helps everybody. So things like wearing masks or promotional campaigns to ensure folks know to stay 6 feet away or stay home when they don't need to go out, or the stay-at-home order, for example, and implementing restrictions on how many people can be in buildings and gatherings are all important things that we can do together to slow the spread of the virus, not just in our community, but in all communities across the county and across this country. And secondly, another important thing that we're doing is to ensure that everyone has access to care and testing. One of the key strategies we have for fighting a virus like this is being able to identify folks who are infected and separate those individuals from everyone else via isolation and quarantine. And that allows us then to trace their contacts, isolate their contacts, and move those individuals out of the population's mix. So we then can slow the spread of the virus or reduce the opportunity for the virus to spread from person to person. So ensuring that access to testing and contact tracing is really critical. And we've done that in this county through the partnership of both of our health systems, HM and Novant, to ensure that all of our community members have access to testing without any questions about how much you can pay or how much about your citizenship status, but ensuring that individuals have access to testing in our communities. Another important thing that we do that's very near and dear to my heart is tracking data, studying data and understanding the data, and really understanding where the disparities lie, and then try to understand what the root causes are so that we can start to do and respond in a very strategic way. It does no good to have solutions that don't fit the right foot. So we work really hard to understand what's needed in which community. And the last thing that's most important and is critically important for you guys who are watching tonight is really ensuring that we have the right information. One of the biggest challenges in any health response or any kind of response or addressing any health condition is information and facts, and ensuring that people have the right information that they need to be able to protect themselves and their families. And so we certainly want to make sure that we get the right information, the key messages to folks who are trusted leaders that can spread that information out to the community. So I look forward to the discussion tonight, and thank you all again for the time.
Good evening. Thank you for joining us tonight. I am David Sanders, your moderator for the evening. We all have times when life feels hard, when we're frustrated and tired and just want to hide away. Thank you for joining us again virtually through Facebook. We are here tonight with an outstanding panel who will provide several ways to cope during the current pandemic and to address questions that you may have. You, our viewers, may type in your questions on the Facebook Live page for the panelists, and we will certainly try to get to all of those questions. Now, each of our panelists will provide a brief comment about their work. Our first panelist, Brandon Risher, is a clinical psychologist from Charlotte, North Carolina. He graduated magna cum laude from the University of North Carolina at Charlotte with a bachelor's degree in psychology and later a dual master's degree in clinical and community psychology. Mr. Risher has worked for several community-based mental health organizations to assist low-income families with their mental health needs. He is quite passionate about meeting the needs of the underserved communities and currently works as part of a private practice group where he focuses clinically with adults, adolescents, children, couples, and families. After the loss of his grandmother, Ethel Lance, a victim of the Mother Emanuel IX, Mr. Risher uses the unique confluence of his grief and pain, along with his expertise as a psychologist, to educate others. You may have seen him on ABC News, Good Morning America, and PBS. Thank you for joining us tonight, Mr. Risher.
I'm taking my mask off just so I can be heard. Good evening, everyone, brothers and sisters. I want to first start by reading a scripture, I think which is really relevant to why we're here tonight. So this is Isaiah chapter 50, verse 4. The Lord God hath given me the tongue of the learned, that I should know how to speak a word in season to him that is weary. He wakeneth morning by morning, he wakeneth my ear to hear as the learned. I read the scripture because we all have to listen, so that we have to listen to the learned so we ourselves can become the learned. And that's part of why we're here this evening, which is to educate and inform the population on this unprecedented event. I'm honored to be a part of this distinguished panel tonight to talk about this important topic. I'm really challenging each person in attendance, both here physically and online, to listen to act, not listen simply for the purposes of just hearing words and hearing syllables, but really listening for the purposes of action. This is a unique time in our history, the confluence of generations of economic, health, and racial disparities are coming home to roost during this pandemic. Many of our brothers and sisters have no idea what to do with all the facts and figures that we're here tonight. We are here to educate and to give people a different perspective, not to hear all of these facts and figures simply through the prism of our fear. I hope tonight we can continue the process of giving more clarity to the populace during these murky times. We will do our best to inform everyone here with eloquence and passion. I don't expect everyone to understand and to know every word that is spoken here tonight. There will be a lot of words and a lot of things, a lot of ideas that will be spoken. What I'm really challenging each of you to do tonight is to really think about and be thoughtful about something that really resonates with you and share that. There's no point of knowing something purely to keep it to ourselves. We've done that too long as a people, and this is another opportunity for us to educate each other. My brothers and sisters, We will get through this. We will. We're resilient. We're resilient people. The question that I have for you and what I want to pose to everyone is this: who and what do you want to be when we get to the other side? Thank you.
Thank you, Mr. Risher. Our next panelist is Dr. Valencia Jeffcoat, who is a board-certified family nurse practitioner who joined Atrium Health in 1998. She received a bachelor and a master degree of science degree in nursing from the University of North Carolina at Charlotte and a doctor of nursing practice at George Washington University. Over the years, she has worked in various healthcare areas within Novant Health and Atrium Health Systems. From 1998 and 2015, Dr. Jeffcoat provided adolescence-based comprehensive medical and mental health care for Teen Connection. Currently, she is a medical provider at the Levine's Children's Hospital Pediatrics Resource Center, Child Protection Subspecialty Team. In this position, Dr. Jeffcoat partners with the Pat's Place Child Advocacy Center and other agencies such as the Department of Social Services and the Charlotte-Mecklenburg Police Department to provide health care for children suspected of physical and sexual abuse and/or medical neglect. Dr. Jeffcoat is very active in the Charlotte-Mecklenburg community, especially as a lifetime member of the Alpha Lambda Omega chapter of Alpha Kappa Alpha Sorority Incorporated. Dr. Jeffcoat, thank you for joining us tonight.
I know that we were allowed to sit down, but I'm more of a stand-up person, so that's what I'm going to do. Thank you for allowing me to come today to talk to you about something that is dear to my heart. We have heard that COVID-19 has impacted our families greatly. Our families are experiencing significant stressors such as unemployment, financial woes, emotional distress. But as a medical provider, and my pediatric colleagues can attest, we are truly concerned about our children during this time. Our children are not as safe as you think they are. We are concerned that they are being neglected, that they are being abused during this pandemic. I know that one of the panelists talked about stay at home. That's a great tool for reducing the risk of contacting COVID-19. However, it is also a tool that is allowing our children to stay at home more readily, more frequently. And in my opinion, this is causing our children to be at more risk for abuse and neglect. Yes, child abuse did occur prior to this pandemic, and it mainly occurred under the cloak of secrecy. At least during the pandemic, at least prior to the pandemic, we had what I call my little guardian angels. Those were our teachers, our after-school program teachers, our daycare workers, our medical providers, our churches, family members. These little guardians were able to visibly see our children. But since the pandemic, the forcing of school closures, daycare closures, we're not going to church. We're not even seeing a lot of other family members because of the risk of obtaining this COVID virus. Many of our children don't have the outside support or the avenues to disclose their abuse. And this is a problem. At least we are giving, the governor has allowed us to do a lot of free meals, so our children was being able to be seen, some of the vulnerable children, just a little bit for a short period of time, but it's not enough. I'm terribly afraid that after this pandemic, the hospitals, the child advocacy centers are going to be seeing a spike in the abuse of our kids. So the most pertinent question to me is, now what can we do to protect our children during this pandemic? And I believe you have to learn how to acknowledge, how to notice a child who may be abused or neglected. And you must be comfortable in reporting it. So very quickly, I'm going to go into a little bit about what is child abuse. Child abuse is an intentional harm or mistreatment of any child under 18 years of age. And that abuse can occur in many forms, and it can occur simultaneously. Some of the forms are physical abuse. That is when a child is purposely, intentionally injured or harmed by another person. There's sexual abuse. Yes, sexual abuse does occur to our kids. Any sexual activity or contact that occurs to a child by an adult, a young adult, or any person who is at least 4 years older than them if they're under 16. This type of abuse can include exploitation of our children, exposure to pornography, and human trafficking. If you're not aware, North Carolina, especially Charlotte, has one of the highest human trafficking rates in the country. Why? Because we are in between major avenues, Highway 85, 95. It's easy to get from northeast to southeast very quickly. So a lot of times when you're seeing these young kids, they are being trafficked, you just don't know what you're looking at. Emotional abuse. That's when you're injuring a child's self-esteem or their well-being. It could be verbal and emotional assault. Then we have the medical abuse, which a lot of us remember as Munchausen by proxy. This is when you give false information to a medical provider, and that allows a child to get unnecessary medical care when they really don't need it. But really it's the attention seeking that that parent or caregiver is giving to keep that child sick. Then we have neglect. That is when you fail to provide a child with the basic necessities, food, shelter, water, but I'll go as far as saying attention, supervision, education, dental care, medical care. When you don't provide children those basic necessities, that's a form of abuse. So I know many of what I'm going to say next may be surprising to you, but approximately 90% of our children are being abused by someone they know and they trust, and that is within the home. That's a caregiver, that's a parent, that's a legal guardian, that's a foster care parent, other relatives, babysitters, close family friends, okay? So what type of warning signs should you be looking for if you feel that a child is being abused? If you have a child that excessively withdraws, becomes fearful or anxious, especially around their own parents or a caregiver, that should raise a red flag to you. If that child shies away or flinches just with a sudden movement or a simple hug, that's a red flag. If the child has frequently unexplained injuries, they always breaking a bone, they always spraining a leg, they have cuts everywhere. If they have unexplained skin findings, such as bruises, burns, skin findings that look like a pattern, such as a fly swatter or a belt buckle or a belt or electrical cord, those are very concerning. If you see a child and they're wearing inappropriate fitting clothes, they're filthy, they're dirty, or they're wearing long sleeves and it's 100 degrees outside all the time, or short sleeves, shorts, no coat in the wintertime, that's a form of neglect. Poor hygiene, not treating or managing an acute or medical problem, asthma, diabetes, significant dental concerns. Like I've seen kids who had dental cavities that were ridiculous and they were not getting dental care. They're frequently left alone or unsupervised. You just see them running around in the streets. No adult is there for them. They're always missing school or they're late for school. If a child has a sexually transmitted infection or pregnant, and especially if she's under 16 years old, you need to start worrying about that little girl. They display sexual acts or behaviors that is far beyond what they should know, okay? and if they run away a lot. I never thought about running away when I was here. Where would I go? That was my thought. But you have a lot of children who run states away just to get away from the chaos that's within their home. So I'm going to throw some national statistics your way. And in 2018, approximately 678,000 children were victims of child abuse or neglect, okay? Of those 678,000 children, approximately 1,700 died from that abuse or neglect. So who are we talking about? Who are the child abuse victims? A child who is less than a year old has the highest rate of being victimized. Why? Because they're doing what they're supposed to do. They're criers. They cry to be held. They cry when they need to be bathed or changed. They cry when they just want to be fed. That's part of their development, but that can be a true stressor to a family member who is already under a lot of stress. Girls are more at risk of being victimized than boys when it comes to child abuse and neglect. However, boys are more at risk of dying from their child abuse and neglect. The American Indian or Alaskan Native child has the highest rate of being victimized, and African American children are a strong second. African American children are twice as likely to die from their abuse or neglect compared to Caucasian children, and at least 3 times more likely than Hispanic children. So I want to talk to you about something that is important. It's called mandated reporting. Every individual in Facebook land here, we are mandated reporters. If you suspect the child is being abused in some type of way, you must report. The report is anonymous. You don't have to worry about being told or outed. In North Carolina, we have what is called a universal mandating reporting, which means any person or institution who knows or suspect child abuse must call Department of Social Service and report that. And that social service, it should be located in the county where the child resides, okay? South Carolina is a little different. They have a specific list of professionals who they consider mandated reporters. And those are child care workers, teachers, assistant principals, members of the clergy. However, I want to stress, there is no penalty in reporting. Just because you report a suspicious case of child abuse doesn't mean the child is going to automatically be taken away from the home. So what if you are incorrect, that the child is not being abused? There's no penalty to you. There's also, but what you have done is that you may have allowed that family to receive services that they otherwise may not have received. Parenting classes. They may need shelter somewhere. They may need help with homelessness. So what I really want to stress is that if you suspect abuse, please report it. You could save a child's life, and therefore they won't have to come to see me. They won't have to tell their story 50 million times, and we can help them before they die. Thank you.
Thank you, Dr. Jeff Coate. Our last panelist is Detective Michael J. Hibbler. I consider him homegrown as he graduated from Vance High School. He has an Associate of Arts degree from Central Piedmont Community College, a Bachelor's of Arts degree in Criminal Justice from Liberty University, and he was a member of the Alpha Phi Sigma Honor Society. Dr. Hibbler has been employed with the Charlotte-Mecklenburg Police Department since 2009. He was first hired as a paid intern known as a police cadet, and in 2011, he started the Police Academy. Once he successfully completed his 6-month training program, he was assigned to a division as an officer. Detective Hibbler worked in the electronic monitoring unit with pretrial offenders through court-ordered GPS monitoring. After several years with the unit, Detective Hibbler was promoted to the Special Victims Division as a domestic violence detective, and he has remained in this position for the last 3 years. As a domestic violence detective, he investigates crimes ranging from attempted murder to cyber stalking. Thank you, Detective Hibbler, for joining us tonight.
Good evening, everyone. Like what it was said before, I am Detective Hibbler. I'm with the Charlotte-Mecklenburg Police Department. It's an honor to be here with so many distinguished guests, to be able to speak about something that's impactful, that reaches all of us. I'm gonna throw out some numbers, but I don't wanna say it so coarsely that we miss the story behind the number. Behind every number is a person. It's a sister, a brother, an uncle, an aunt. 1 in 6 people are affected by domestic violence. That means someone in this room has been affected personally, or they know someone, whether it's during childhood where they experienced seeing it, or whether it's adulthood where they saw it happening right in front of them. It is, by all means, horrible and it's egregious. And it is the mission of the department, specifically the domestic violence unit, to obliterate it. Now, some say, oh, it can't happen, but I will call false on that. Domestic violence works primarily through power and control. How do we combat that power and control? A person using leverage through isolation, financial, mental leverage against another person. Well, it comes down to community. How can we come and partner together? Some of the things that I'll say, I'll go over some quick topics, but as I'm speaking, please, in your mind, or if you have a pen or pencil, write down some notes, some questions that you might have for me, because I think it'll be helpful. Helpful not only for maybe yourself, but for somebody that you love and that's dear to you. Community means being able to speak to a brother or sister and say, hey, I need some help. Part of what that help may look like is having a go bag. In that go bag, you may have simple toiletry items like toothbrushes, toothpaste. You can go to Walmart, they're like $1 each. Really cheap, significant, but powerful, because in the time of dire need, guess what you can have? You can have something that you can grab quickly. You can call a neighbor that's right down the street and say, hey, I need some help. Can I stay with you for the night until I figure out the next place to go? And you know what? Even during the time of COVID, there are places for you to go. Safe Alliance has a battered women's shelter. You could simply call ahead, 980-771-HOPE. Call that number and they will screen you in and they will find out the best placement for you. It can be tough, but even needing someone else isn't so bad, because at the end of the day, that means you can be an advocate for the next person and so forth. Other things that you can do, you could make sure to reverse your car into the driveway so that you can always have an easy way out. Make sure you have locked doors. Amazon has amazing resources in that you can order doorbell cameras that capture everything. And you can have people that live near you or people that are very close to you to call in and check in on you. Create a safe word so that when you say that word to that person, that trusted person, they know something's wrong and they can call 911 for you. During this time, it's very important. Please don't be afraid to call and get some help, because at any moment, somebody could be right there at your door and that they can help you out. So I really look forward to the questions. I look forward to having this open dialogue where we can help grow each other and we can build on that community. Thank you, and I look forward to speaking soon.
Thank you, Detective Hibbler. And now we're going to open the mics for questions and answers. So I'm again asking our Facebook viewers to type your questions in, and someone will get them to me. We're going to start with the first question, which is going to go to Dr. Jeffcoat. The question is, do all alleged abusers come from bad families?
Actually, that's a myth. Child abuse occurs through all socioeconomic statuses, cultures, racial lines. It doesn't, children or parents don't start out thinking that they're going to be abusers. Sometimes it just takes that one little spark to cause them to overreact to a situation, such as I was saying about the crying. A lot of times children are abused mainly because of just that fact. They are criers. So many families aren't considered bad families. The person is not necessarily considered a bad person. It's just that that person does not know how to cope with certain situations. So no, that is a myth. Abusers aren't always coming from bad families. There have been some abusers that have come from very predominant neighborhoods, and that doesn't mean that it's just the bad neighborhoods.
Thank you. The next question deals with health disparities and is open to the panel. Many people are being turned away from ERs and physicians' offices due to their inability to effectively explain their symptoms. This is a strong correlate to healthcare disparities in Black and brown communities. Can any healthcare providers on the panel give any advice on some keywords that people can use more effectively to explain their symptoms when speaking to a healthcare provider?
I guess that's to me.
How about you?
You let me go first? Okay. You go in second. There is really no key word. It is what it is. If you are experiencing a temperature of over 100.4, if you have shortness of breath, if you have respiratory issues, if you're having headaches or no smell, no taste, those, I guess, if you can consider keywords. But I wouldn't use keywords. If you're having the symptoms, you're having the symptoms. There's no need for a keyword. If you're sick, you're sick. There's no need for us to test everyone out here because we don't necessarily test everyone who has the flu. If you come in with flu-like symptoms, we will test you for the flu. If you come in with COVID-type symptoms, we will test you for COVID. So I'm not quite sure where the key word would be. Just if you're sick, just go to the hospital or your doctor's office and tell them what your symptoms are factually, and they will take care of you.
May I respond?
Yes.
Okay, because I posed that question.
Okay.
I respectfully disagree in this sense. The question is about how a populace is not educated enough to describe their symptoms properly. One of the reasons why we wanted to bend the curve was because we did not want the hospitals to be overloaded with patients. Well, if I'm saying I'm hot versus I have a basal temperature of 98.5 and now my current temperature that I've tested for the past 3 times is 101.3, that in effect is a keyword to be able to distinguish between the healthcare providers who are human in a time of crisis to say, okay, this is enough of a significant difference for me to find a bed for you versus saying, no, you need to go home and come home, because that's what happens a lot of times. A lot of our Black and brown people are turned away from hospitals because they are unable to effectively communicate their symptoms to a healthcare provider. If I can say that my temperature is this versus I'm saying hot, somebody might listen to me a little bit differently than I would, because I'm not assuming that all these other racial and socioeconomic factors don't play a factor in how someone hears what I'm expressing to them. So that's why I posed that question, and that's why I wanted to comment in the way that I comment, because a lot of times the healthcare disparities are a lot of times based on when you walk in the door, how well can you explain what's going on?
Well, I'm not understanding. I don't know what you're talking about. Typically, I know how to ask follow-up questions. So if you tell me that you're hot, I'm going to ask you what is your temperature, and I'm going to take it.
Yes.
And I'm going to ask you subsequent questions so I can get around on what is your total crisis looks like.
Yes.
So I'm not familiar with what you're talking about, and maybe I'm not the person that can answer that for you.
So are you saying that you're unaware that there are disparities
Oh,
in
I'm
how...
very aware of disparities, and I do know that there are some languages that some clients come in that I understand that my counterpart may not understand or take it even further. So I can only go based on what I do and how I care for my clients. So yes, I can agree with you that there are disparities, but I'm not familiar with what you're telling me or saying. I'm sorry.
Okay.
Other comments? Oh,
But that was a good question. Underhanded question, but that was a good question.
okay. Again, for Mr. Risher, given the stay-in-place demands, or in this case, commands, what are some coping mechanisms for those struggling with depression and stress during this time of COVID-19?
Well, first and foremost, I would say understanding the nature of your surroundings, first and foremost. Right now, because we've been social distancing, a lot of families you have more and more bodies occupying the same real estate as they did before. So going to domestic violence, going to child abuse, some of those correlates is due to just not being able to have room enough to be able to really kind of decompress from some things. So what I would say first and foremost is to be able to understand kind of what your basal behavioral rate is. So for example, if you're typically a moody person and all of a sudden you just extremely like manic or happy, then that's a difference, right? We're always looking for this fixed, defined idea of what good and bad is, and sometimes it's a change that is a manifestation of something else. So depression looks different in each person. Some people lose pleasure in the things that they want to do. That's anhedonia. Some people kind of are Eeyore-ish, and they're just kind of like, it's like a cloud hanging over them. What I would suggest is not only can you assess that yourselves, but also for the people who know and are around you the most, to actually listen to what they're saying and the differences that they're seeing in you and taking that into account. There's a reason why we have the term signs and symptoms, because sometimes somebody can see something in you that you cannot see in yourself. And if you integrate those two things together, then maybe you can have a completer picture of what's going on. And then you can say, you know what, I need to go take a walk. Hey, can you watch the baby or can you watch the child? And I might take a 30-minute break. Now, that may be difficult in reality for people to do, but without even asking for a way to decompress, that energy is going to go somewhere. And unfortunately, we are here because we're talking about how it is sometimes with disastrous results manifested through other people.
Anyone else like to comment?
Yeah, I think one of the most important things that folks can do to keep themselves uplifted in these difficult times is to stay connected to people. Technology has allowed us to do a lot of really incredible things in terms of being able to stay in contact with those that we love and care about and those that bring us joy. So I would encourage folks to do that in this time and stay connected as best possible. And as my brother just mentioned, stay physically active. That helps your body physically and obviously helps your body mentally. Take a walk, run around the house, do whatever you have to do. And of course, if you feel bad, seek help. I mean, there are ways to seek help without having to go to a healthcare provider. You can certainly make contact virtually or via telephone if you do feel like you are get into a dark space.
Other comments? Thank you. Detective Hibbler, what should a person do if they begin to see a situation escalate within the home?
Thank you for the question. So one of the things that I really like to pose to folks is to kind of know who you are. Know your hot buttons. Know if you're living with someone, know theirs. Get to know that person, because they may have a different response than you may have when you become angry. Some folks might get silent and some may be a little bit more boisterous. If you start seeing that tension to rise, if you have the room, please go to another room and just take a time out. Take a second to gather yourself together. Another thing that may also be helpful is if you're capable and you're willing, work out. Great stress reliever, great way for you to be able to push off some of that tension. Other things that you could do is just take a break and go to a friend's house. Spend the night and do what you have to reasonably, and of course within CDC guidelines. And then enjoy your own hobbies. I know I like to watch movies. That's a stress reliever for me. So sometimes I may just take a time and just do something that I really enjoy. That way I don't focus on what was, and then I can look forward to what can become. So thank you for that question.
Yes.
One of the things, so to your point about the hot button issue, I think it's also understanding from the other person's perspective what you can say versus what you should say under different circumstances, right? Some people will say, we've seen a lot in the news where I'm an American, I should be able, or I can be able to do blah, 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 blah. But should you do it under the circumstances? If you know your man or your woman is getting hot right now because of some issue, and you're like, well, I should have the right to be able to say exactly what's on my mind, despite what you're seeing, what you are implicitly saying is that you haven't learned anything from your wife, your husband, your child. Learning about someone is being able to take what you're seeing in a moment and superimpose that upon all the old things that you have seen to be able to come to some conclusion that is different than how that would be purely on the basis of emotion. So what I would say is know your partner, know your child. You know if your child is getting riled up and he's about to have a tantrum, you know what that looks like. You should know that better than anyone. So to act as if we do not know that and put all the responsibility on one person, each person is having 100% of the responsibility and no percent of the blame. So what I would say is know your partner, talk to them, learn them, be able to be vocal about that, because without that, you're just going to say, he looks a little anxious, and you're going to tense up versus saying, hey man, what's wrong? So you can diffuse that so it does not go so long, because a fuse was not always short. At one point, it was longer. It got cut for a reason, or reasons. So we have to understand what those reasons are if we're asking to, particularly during this time where we have to be around each other for so long.
I would like to comment.
Okay.
One thing I'm hearing, though, is I think that we are asking people to do some things that they're not capable of doing. They haven't learned how to do. They've grown up in households that were chaotic, and all they did was argue. And how did they express themselves? They got louder than the person that was talking. That's easier said than done. I think that COVID happened so abruptly that you're asking people to do something that takes years to learn. I've been married almost 30 years, and I'm still trying to learn my husband's views. I can see them, and I know how to step away, but I got 30 years in, and I got so many years of age on me. But the younger ones, the hot-headed ones, the ones who they haven't had anybody to show them how to better diffuse. So I'm not saying that it can't be done. I'm just saying that that's why domestic violence is so bad now. It's because you're asking people who've never learned how to do that in a short time, in a small space.
Yes,
so
what I'm asking them is to start the process.
Yeah, starting the
Learn.
process, that's different than knowing it.
No, I said
Okay.
learning, which is a
Okay.
process.
Got
I'm
it.
not saying knowledge. Knowledge doesn't care to know.
Got it.
I don't want to be adversarial by
Right.
any stretch
Right.
tonight. I want to make
Right.
this clear. We're all here for the same reason.
Right.
But the process of learning is different than saying that I've acquired knowledge from which there is nothing else to learn. That's not what I'm saying.
Okay.
We have to start somewhere. We just can't keep saying that, well, they haven't learned. Well, being modeled something is different than what is being taught. In that case, why are we going to school? Like, we have examples such as us out here to show people that there is something beyond the walls of their home. So I feel that I and all of us are examples of what someone can be. Before this, kids were out from the ages of 5 to 18 in an environment that wasn't with their parents, where they saw adults who were well-mannered and knew how to take care of business. So I'm not going to simply ascribe a bad behavior because a child only sees a parent and says, well, I've seen this model to me, I have no accountability. That is, to me, that is speaking from the basis of oppression. And I personally don't subscribe to that. My job as a therapist is to say that, first off, there's something to learn. Not saying that, sorry, man, I mean, you've been taught this for, 20, 30 years. Having 20, 30 years of experience is different than having 20, 30 years of maturity. So if we want people to mature, we have to start that process of getting to learn something. Not saying I got 20, 30 years in the game, because then people who have 20, 30 years in the game come see me.
Yeah, I don't.
Right. No, I'm not saying you don't. I'm speaking as a representation of our people, and we're not a monolith.
Yeah, I think this is a time, this is a difficult time for everybody to be starting a lot of new processes. Even though we can start, but we're doing everything different. You're not going in to see your therapist. You're doing it virtually, which you don't have the close contact that you really need to do your job. So everything is different these days. So you just have to give people time to learn those things. So that's all I was saying. All right.
Go ahead.
Yeah.
I think I'll jump in a little bit.
Yeah.
So I have a church that I grew up in right off of Eastway Drive, and for years I've asked the pastor, please, let's do an online platform so that we can tithe and bring our offerings that way. For years. And around the time COVID started, probably a month afterwards, lo and behold, guess what popped up on his website? PayPal, PayPal, ability to pay through Apple. And I said, wow, thank you. This makes it so much easier, because it is difficult for us to come together, because it is difficult for simple gatherings. And I say that to say that, and these guys know it better than I do, that people really are resilient. And these are tough times, and people have had to make choices and to change things up in such a way where they probably wouldn't have said before, man, I could really do this. So I know we're all up here and we're encouraging folks that are on the other side of the screen. But I really believe that I'm optimistic that people are resilient, and we're going to see some great things come out of this horrible event.
I really think that's a great segue to our next question, given the effect of change in which we are currently involved. The question is this: what can we do in our community to encourage our people to ask for help? And I'm asking the panel.
Well, also the easiest thing that we can do to encourage other people to ask for help is to, one, ask for help ourselves. And then two, when we do ask for help, get help, and it is successful, share that same story with other individuals that you know and love. When I had a conversation with a group of brothers, by the way, I forgot to mention I'm a good brother of Kappa Alpha Psi Fraternity Incorporated. I forgot to put that in my bio. It's really important information for you all to have.
Thank you.
But we're having a conversation about the whole notion of going to see a therapist, right? And what that means, and the discomfort that we in our community have with the idea or notion that therapy means that something's wrong with you or you have some kind of defect. And it's no different than going to seek medical care, right? Black men particularly are very cautious and optimistic, or cautious and pessimistic of going to see medical doctors for a lot of reasons, some of which are very good, but there's also a lot of good help that you can get by going to a medical doctor. So I think one of the best things we can do is get help for ourselves, and then when we get good help for ourselves, to share that experience with other people and encourage them to do the very same.
Others?
I think piggybacking on what he said is, be the ones who are aware that someone needs to speak, can they be assertive in asking questions for them? How you phrase questions has a lot to do with how someone is going to respond to something. If I ask a question that is confirmatory, such as, do you believe this, yes or no, that doesn't give me any information. It just confirms what I already believe. So what I would say is, for the ones who can speak, be diligent about how you ask people and be assertive about that. If you, like with domestic violence and child abuse, if you're a mandated reporter, it's because you have to be assertive in saying something about it. Be assertive. Not everyone is going to be assertive. Not everyone has the voice to be able to do that, but once they see that that's something that their vulnerability will be met with care and compassion, they might be more apt to do it again. So that's what I would say, kind of on a more existential plane.
So essentially what I'm hearing is that you're saying that it's important to take the risk.
Yes.
To take the risk.
Strategically, right? Risk is a dirty word, and it's not. Security, we look for security so that we can take strategic risks. Safety is just the preservation of what we have, and we conflate the two. So if we want people to ask questions, we have to arm them with the knowledge of how to ask it and what information are they really seeking. And that is risky. Learning is risky. They call it growing pains for a reason. It's painful. Either you're going to grow because you're going to learn, or you're going to grow because you're going to be stagnant. So for the ones who do know, we cannot hold this to ourselves. We have to educate the ones who are, let's say, less fortunate, less educated, whatever you want to call it. Is it incumbent upon us because we've been blessed with this ability to do it, and we need to take the reins in being assertive in doing that so that we can model that for others.
And it is certainly an important step. Let me take a moment to thank our audience. Well, I have quite a few questions that I want to get through. And so I wanted to thank you for sending in your questions. The next question is going to Dr. Washington. How often should an individual be tested, and is there a frequency? And the example that I would use is about 3 weeks ago, I was tested. Fortunately, it was negative. And as I understand it, that test was an indication of the previous weeks. And it let me know at that time that I was negative going forward. But my question is...
To let you know you were negative up until that point.
I have been negative up until that point.
So the day you got the test, you were negative,
Yes,
according to the test.
according to the test. So going forward, should I be tested again? And if so, how often and how far apart?
Great question and great scenario. So in the county and across this country, we've gone through several phases of availability of testing. Obviously, everyone knows COVID-19 came without any real, a lot of preparation to go into it. We have been able to successfully expand our testing capabilities in our community, both here locally, across the state, and really across the country. Not enough, but we are able to do a lot of testing. The tricky thing about tests, a diagnostic test, and there are two different types of tests, and I'll explain this just because I think it's important for folks to understand it. There's a diagnostic test that checks to see whether or not you're actually infected with the virus. Those tests are not totally sensitive immediately. So if you were in a grocery store or if you were in a closed space and you came into contact with someone who was COVID positive and you picked up the infection, that day you will not test positive for COVID-19. The likelihood that you will test positive in any day in the first 5 days thereafter is much less because your body, the test looks for particles of the virus in your body, and it has to actually reproduce fast enough so that the test can actually detect the RNA of the virus itself. And so because of that, we don't recommend individuals, if you've just been exposed, the likelihood that, like today, the likelihood that your test is going to be accurate is fairly slim. And so the test also only gives you a snapshot of that one point in time. So if I got tested a week ago and I was negative, unless I went home and bunkered myself down and made no contact with any other individual and no contact with the surface that had the virus on it, essentially my risk of picking up the virus continued after my sample was collected from the test. And so when I went to go get the test, or while I was out that day, if I made 2 other stops, I could have picked up the virus. And so the test only tells you a point in time, which is why we've been very specific about who should be tested and when they should be tested. At this current time, we have extended our testing capability to be able to test people who are symptomatic with any level of symptoms. There was a point in time where we were really only testing individuals who had the most severe or moderate symptoms, and those individuals were prioritized for testing. We also are prioritizing individuals who work and live in congregate settings, because those individuals are more vulnerable, and the likelihood that they can spread the virus is much greater. And individuals who work in critical infrastructure jobs like construction or grocery stores, if they have a high-risk exposure, meaning that they were in contact with a person who was potentially positive or potentially had the virus for a long enough period of time in close enough contact with those individuals, we'd recommend that that individual be tested, not immediately, but at some point in the 5 to 7 days after that exposure happened. And in the meantime, you may be asked to quarantine. You may be asked to stay home just in case you are infectious. Because the test may not be sensitive to your infection does not mean that you're not able to spread that infection to other people. So we've been very specific in terms of who should be tested, because of every test takes up critical supplies that is necessary and needed, and we don't want to waste tests on individuals who are either have their exposure wasn't soon enough, or they have incredibly low risk for actually being COVID positive. There have been over 70,000 tests done in Mecklenburg County. We have a long way to go in terms of our testing capabilities, because again, the reality is the test only tells me what happened before the day I took the test. It doesn't tell me what happened the morning of it. It doesn't tell me what happened the week after. So just because you get a negative diagnostic test doesn't mean that you're in the clear forever. You shouldn't go out all willy-nilly and do what you want. It just means at that particular time, you are not infectious sufficiently to be able to detect the test. The second type of test is an antibody test, and that's really meant to detect whether or not you've been infected before, and more likely your body has developed an immune response to the virus to allow you to then be able to actually have antibodies for the virus in your body. Those individuals are less likely to still be infectious, but still could be infectious. And the sensitivity and specificity of those antibody tests is still largely being studied, and there's a lot we still have to learn about them. And again, they don't tell you about, they don't do a great job of detecting active infections, because it takes some time for your body to generate that immune response to the virus when it's in you. So the long and short of it is, if you have any symptoms, any of the key COVID symptoms, particularly if you're at high risk, if you have chronic illnesses, if you're older, if you work in a congregate living setting, if you're a first responder, if you work in critical infrastructure, and you have any symptoms of COVID, so that's a fever, a cough, a new headache, chills in your body, excuse me, what did I miss? Aches and pains, muscle pains with the headache in your body. If you have any of those symptoms at all, any type of them, you should definitely reach out to be tested. And if you have questions or think you should be tested, feel free to contact the Mecklenburg County Public Health Hotline. We're open every day from 8 until 6 p.m. But if you call the number, you can get in contact with both Atrium and Novant's healthcare systems for testing information as well, to find out where you can go to get tested. And that number is 980-314-9400. Again, that's 980-314-9400 to get in contact with our staff to be able to help you navigate where you might go to get tested and whether or not you should be going out to do so.
May I ask a follow-up question to that?
Sure.
Certainly.
With social distancing, why is it 6 feet as opposed to 4 feet or 10 feet or 7 feet? Like, why is that distance the prescribed distance that we should be apart from each other?
So that's a great question. The 6 feet allows individuals. It's all sort of actually physics, if you ask me. And I'm not an expert at the logic or all of the decision making around why 6 feet was chosen. But essentially, 6 feet allows enough distance that if I'm speaking to you or that I'm breathing, that my aerosols will not have enough time to be floating in the air, assuming we have adequate airflow in a room, to that it will be in close contact to you. So as I'm talking right now, my aerosols are going this way, right? And so they need to go out and down, right? Gravity is going to pull them down at some point, depending on the flow of the air in the room. And so 6 feet just is the middle ground where other scientists, not me, and I'm an epidemiologist, this is not my profession, but that's where they've decided is a good margin of a radius to keep around you for distance.
So if I'm hearing you correctly, the concentration of the particles that are coming out of our mouth, by the time it gets to 6 feet, it may not be concentrated enough to affect us in the same way that maybe at 4 feet or 3 feet it would be.
Potentially, yes.
Or it may not reach you.
It may not reach you. Yeah.
Or it may not reach you.
Yeah.
Yeah. There's another question as it relates to COVID-19, and you really did touch on it during your opening remarks. But here's the question. Does COVID-19 manifest itself differently in African American communities? Symptom-wise, if so, please describe those symptoms. And you did some of that in your opening comment.
Yeah, so we haven't, there's no clear evidence that there is different subsets of symptoms that are impacting individuals with different racial ethnic backgrounds separately. It certainly has different impacts on individuals who have underlying chronic illnesses, and depending on what those chronic illnesses are, you may experience a different type or different level of symptoms. There aren't any specific symptoms to any specific community, so I think we have been telling individuals largely to look for any of the symptoms on the list. The one I forgot earlier was the loss of taste or smell, but we haven't seen any racial differences in terms of those particular symptoms. I guess I'll say to everybody though, COVID-19 is still new, right? And so there's a lot to learn, and so much of what we said 2 months ago has completely changed in many ways. And so as we continue to learn and study and understand, that third bullet on my first slide was critically important for us in public health, is to actually continue to study those things and learn what differences you might see or expect. The only big difference, I think, in terms of symptoms that impact a group of people differently, we have heard recently of small children or younger children who are having a different inflammatory illness that seems to be in some ways connected to the virus. But again, there's still a lot for us to learn. And so I think individuals who have any symptoms, any healthcare symptoms, not just in the land or space of COVID, but in general, as I said earlier, contact your doctor. If you don't have a doctor that's your primary care physician, you should feel free to reach out to both our local health systems have outpatient practices. C.W. Williams, who's a sponsor of this event tonight, is an incredible federally qualified health center that can provide care to you regardless of your ability to pay. And we have another Charlotte Community Health that's able to provide care. So I think if you have any symptoms of any health condition or feel bad, don't go on Google. It's not your best source. You should reach out to a medical professional to get support and care.
I have a couple more questions for you since you're talking.
Okay.
According to some, the cloth mask still allows droplets to reach people. Is that true? And are COVID-19 cases calculated as part of other causes of death?
Okay, two completely different questions. So I'll take the first one first. So cloth face coverings, which are incredible tools to help us with slowing the spread of this virus, are not perfect. And I think there has been adequate evidence that wearing cloth face coverings, first off, they don't help me from being able to breathe in your particles. They really slow the ability of my particles to be able to leave my mouth and go into the air. And so, yes, they are not perfect. They are not as effective as other types of mask, but in fact, they are a very useful tool in combination with a number of other strategies which we've been recommending to folks. So you should certainly wear a cloth face covering if you can't keep 6 feet, but 6 feet is much more important than the cloth face covering itself. So keeping your distance from other people is much more important than actually wearing the mask or any kind of mask really. And ensuring that you practice good hygiene. So wash your hands, wash surfaces, don't touch stuff you don't need to touch. When you go to the grocery store, don't pick up everything in the store. You know how you used to look at a bottle and read all the labels. So don't read every bottle in the store, and if you're gonna do that, try to minimize the number of times you touch things that you're not going to purchase and take home. And obviously don't touch too many surfaces. So if you touch a door, use your elbow, use your arm. Don't shake people's hand. That's one thing I don't think we'll be doing for quite a long time. Use your elbow and keep your distance as best possible. But the mask is certainly helpful at reducing spread. The best case scenario is that I have on a mask and you have on a mask too, because that then keeps your aerosols down, keeps mine down, and it does offer some percentage of protection in terms of me being able to breathe in what's coming or what's in the air from you and everybody else. The second question about COVID cases and other causes of death. The CDC has very clear guidance about attributing COVID-19 deaths to attributing a death to COVID-19. So if an individual has a laboratory confirmed case of COVID-19 and it contributes to their death, it should be listed on the death certificate as a cause of death or contributing cause of death. In many cases, as you know, here in Mecklenburg County, almost all of our decedents have had some underlying chronic health condition, whether it be heart disease, diabetes, dementia, or any other chronic condition, asthma, that's also contribute to their death. So COVID-19 likely is not the only thing on the death certificate. Similarly, if a physician does not do a COVID-19 test and they suspect that that individual has COVID-19 or it may have been a part of their contributing cause because that person either has, they had a cold the day before, they had symptoms of COVID-19 the day before, they're encouraged or guided to actually write suspected COVID-19 on the death certificate to improve our ability to be able to look at this overall. The tricky thing is those death certificates have to be processed by the county, then they have to be processed by the state to be finalized. So right now, in terms of us counting COVID-19 deaths, we're only counting deaths in cases that had laboratory confirmed COVID-19. So a person had to be tested, diagnosed via a laboratory test, either while they were living or post-mortem. They could have also been, the medical examiner has the ability to test if there is a justifiable reason to do so. It's not sort of test every person that's passed in our county. I think one reality for what we've been talking about all night, though, is that it's not just about COVID-19. This pandemic, the response, the necessity to shut things down has had a number of impacts on our communities, not just communities of color, but the community at large, and that really, and maybe disproportionately to the communities of color for a lot of different reasons, underlying economic differences, et cetera. So there's certainly, there will be some unintended consequences of this pandemic. There will likely be unintended deaths or deaths that have been caused because of other forces or decisions or the response to the COVID-19 pandemic. And I think as we move, as time moves on and our bandwidth expands and we have more data, we're able to understand more what some of those causes are. Of course, there have been things like speculations around drug overdoses, speculations around domestic violence. I think we are still looking at data very closely, and time will allow us, as those death records, which take a long time to process, are finalized, we'll understand better what the real impacts were.
I'd say something to that, because I'm trying to understand this in real time too. So I think the question, if I heard it correctly, and you answered it beautifully, it was about a cloth mask versus like a medical grade mask or a surgical mask, right? As far as its susceptibility to spread the virus, does one stop it more than the other? If I heard the question correctly.
Yeah.
Okay.
Yeah, so certainly there are.
Hold on.
You had a comment.
Okay, so what I was saying is this. So masks are basically, this is just my layman's, again, I'm not a doctor by any stretch of the imagination, but masks are essentially filters, right? They're filters. They filter certain things, they prevent things from going in. There's a selective permeability to a mask. Well, if I take water and I take a bandana, for example, and I pour it, how long does it take to seep through? Versus, a coffee filter, right? So yes, the odds are not the same. Yes, a cloth mask will, it will kind of stop or stunt the aerosols that you say that will spread. It won't in the same way as a surgical mask. It's not an equal chance, but it does help. It's better than nothing. So as far as, if we're saying, if the question is about a comparison to medical grade or mass-produced masks versus something that is homemade, then I feel, based on what I'm hearing, that the answer to the question is yes, there is an increase, but not so much so that you would have to be necessarily concerned as long as you're adhering to the other guidelines that the CDC and Mecklenburg County is asking you to do. Does that?
So I'll say we're currently recommending individuals wear cloth masks while they're in public and when they're in places where they cannot socially distance appropriately. And that's critically important. We are not encouraging and in fact discouraging individuals from wearing surgical masks and other types of masks, N95s, particularly those that you buy online that may not be real, they may be counterfeit in many ways. But the principal reason for that is because we know we don't have enough supply for the folks who actually are taking care of patients with COVID-19 and have a really, really high risk of contracting the virus by virtue of the work they're doing every day in hospitals and long-term care facilities. And so we are discouraging folks from buying up the supplies of those because we do need them for our healthcare workers who are at greatest risk as they are providing direct care to our loved ones on a daily basis. And so the difference in terms of risk is obviously lower with those medical grade masks, but certainly we are discouraging folks from using them.
So the crux of the matter for the caller was whether or not it's going to stop the droplets. And what I hear from both of you is yes.
Yes.
It's going to at least
It will
slow it
certainly,
down.
you should certainly use them, yeah.
Yes, and they should be used. I've got quite a few questions, so I'm going to change a little bit here and go to Detective Hibbler and Dr. Jeffcoat. Is there a correlation between child abuse and domestic violence?
So, as it regards to COVID or
I think it's, as I understand the question, the caller wants to know, you've got cases of child abuse and you've got cases of domestic violence. Is there a correlation? Are they connected? That's how I'm hearing the question.
Yeah, they somewhat intermingle because while, and feel free to chime in, while there may be a child that's being victimized, that same child could also conceivably be assaulted by, well, not the child, but an adult may also be an abuser at the same time to an adult. I investigate intimate personal violence between adults, and so some adults can commit crimes that have a range. Not just with child abuse, they could also be committing financial fraud. It could be the whole gambit. So there can be a connection between the two, at least from what I've seen on my end. Do you have anything to add on to that?
I agree with you. Typically, if you have an environment that is conducive for domestic violence, there's more than one violence that is occurring within that environment. Domestic, child abuse, verbal abuse, emotional abuse. So they, in my world, go hand in hand. Not saying that one occurs, has to occur with the other, but when you see one, you're probably going to see more than one type of abuse within that home.
Is there a question asking essentially if you are apt to hit your child or your spouse, you are more apt to hit your child or your spouse, right? Is that what that's basically saying? Like
That's not what I'm getting from.
No, but the correlation is a positive one, right? Like as one is able or is more likely to hit a child, does it also increase the chances of them hitting their spouse?
That's how I'm
right?
reading it.
That's essentially what the question is saying. I mean, sans data, that just kind of makes logical sense. If somebody's willing to hit their spouse or their child, they're probably a little bit more impulsive, and they're probably more likely to hit someone else in the home because people tend to hit people who are around them. And with a lot of people being in the home and a lot of people, not being able to have these outlets, I would imagine, particularly during the time where people are at home, that yes, one would increase the likelihood of the other.
So there's two foundations to committing a crime. There's time and there's going to be opportunity. And both of those can correlate, especially if there's people in the same space and time for that same person to be able to offend against multiple people. And so that's kind of a general correlation that could happen. Doesn't mean that it happens every time, but it's all about access, right? When you have access to a person and they live in the home with you, nothing happens in a silo. Nothing happens in a vacuum. Multiple people can be affected by that.
While you're talking, Dr. Jeffcoat described signs of child abuse. What are signs of domestic violence?
Some signs of domestic violence is going to be, some of it's just going to be pure silence. A tactic that folks often use is isolation. So if you're not hearing from a brother, sister, whoever for a long time, that's probably a good red flag to check in on them and see how they're doing. Especially if you're seeing mood changes in them. Maybe they're a bit jumpy, or they have unexplained bruises on them. Or even if it could be something cryptic on Facebook or Instagram where they're calling out for help, but they're not necessarily laying it out. There's multiple ways, depending on personality, how a person may choose to either speak out and say, hey, I need some help, or maybe try to hide and avoid the stigma of being in a domestic violence situation. I think it comes down to knowing people and knowing who you care for and who you love. to be able to pick up on some of those specific signs and symptoms.
Dr. Jeff Coate, 2 questions for you. Is there a statute of limitations on child abuse? And do you expect an increase in reporting when school starts back? Have additional protocols been put into place by local school districts?
What was the last one? Additional?
I'll repeat it after you ask the first one and
Okay.
give you.
I'm not quite sure about the statute of limitation. That would be best answered by.
I can jump in.
Yes.
Okay.
So typically for any felony charges, there is no statute or limitation. For those that may not know what that means, a statute of limitation is a law enforcement officer's ability to be able to obtain probable cause and then bring a person to arrest effectively. For any felony charge, there is none in the state of North Carolina. For misdemeanor charges, it's upwards of 2 years. So for domestic violence and child abuse, they both have misdemeanor and felony offenses. And so depending on what's happened, they may or may not have, they may have a shorter statute of limitation or a longer one.
Okay.
So
The second question, or the second 2-part question,
Yes.
is do you expect an increase in reporting when school starts back?
Absolutely.
And the next part is, have additional protocols been put into place by local school districts?
Definitely, I believe that there will be an increase. Most of the reports that come into DS, Department of Social Services, are reported from within the school system. That is a great place for children to feel comfortable enough to disclose. A lot of times children, and people don't believe this, don't realize, especially the sexual abuse part, don't realize that that is not right to do to me. So when they have these classes that tells them of sexuality, how their body works, they kind of realize that that's me and that should not be happening to me. So they are able to disclose a whole lot readily at the schools. I'm not quite sure what CMS has put in place. That is not a question I think I could answer readily, but someone else on the panel may.
I can't go into great detail, but I'll tell you the County
Right.
Department of Social Services is certainly, the first thing I'll say is they're working really hard still. And I think they are still working, they're still visiting people's homes, they're still following up on cases that are being reported and doing everything possible to ensure that we are protecting the health and well-being of our most vulnerable, the kids in our community. And certainly preparing for what happens when the school systems and summer camps are reopening and daycares are reopening. So we do expect, and there's a usual seasonality to reporting. It goes down some in the summer, goes up in the when school is in session, has already been mentioned. And so that kind of preparation is already happening from a response perspective. Of course, our primary goal is prevent this stuff and to intervene before we get to the point of having to intervene or respond, or before they get to the hospital or anywhere else. But certainly we are working to be able to have our teams in place to be able to respond.
Matt.
I'm going to bypass you this time
Sure.
because I have quite a few questions for you.
For me, okay.
For you, but I want to ask Dr. Washington this question because this was one of the first questions that came in.
Oh, okay.
As a school teacher, what procedures will be established to educate, demonstrate, and practice daily with students to ensure we are doing all we can to prevent virus spread within CMS schools?
Oh, that's a really heavy question. So,
Yes.
so we're currently working very closely with not just CMS, but also the private schools, the charter schools, the Catholic Diocese, and others to convene them to ensure that there are a number of guidances that are being that have been released and are available, and we are supporting as it relates to what classrooms look like in a pandemic environment. We are hopeful and excited about the fact that kids have been learning throughout this process, but understand that that's not perfect. And so we're working closely to advise and guide those individuals, both in the school district, CMS, as well as the private schools, as well as the colleges and universities, where residence is another challenge that has to be faced. Again, I think at the very core of all that we do, though, the basic prevention measures of keeping socially distant, both in terms of while you're seated, while you're moving around, where possible, if you don't have a health condition that is counterintuitive or counterindicative, you should wear a cloth face covering, and then practice great hygiene. So ensuring that you are disinfecting surfaces in classrooms regularly, ensuring that students are using hand sanitizer, but also going to the bathroom and using good old soap and water for 20 seconds or longer, and ensuring that individual students, which is going to be a new challenge for us to face, are keeping that 6 feet distance as best possible. And so I think the CMS, as well as the private schools, charter schools, and the universities will be instituting a number of measures. And so I just encourage all the teachers to be patient, because this is going to be incredibly difficult for the systems that have to make these tough decisions, but as well as for the students who have to live through them. And granted, they've been at home all this time. Most of whom I've talked to are going crazy, but but they're struggling a little bit because that's what kids are supposed to do in these unusual times. So I continue to pray for you guys as teachers for patience. And prepare for extended necessity of patience in this environment as we all get used to these new sort of conditions that we're living in.
This question is for Mr. Risher, excuse me, and I think all of the panelists may have some comment to make. The question is, what counseling resources are available for the younger generation in our community?
Oh, that's a great question. So I will preface this by saying there are gaps. There's like this underserved who make enough not to have Medicaid or Medicare, but not enough to be able to pay their copays or their deductibles with insurance. So we have to be very cognizant of that. There are some groups out there that can subsidize. A lot of therapists have sliding scales. There's community support, intensive in-home, I believe that's still a thing, ACT team. So there are various, what they call wraparound services that people can use to be able to best get the attention that they need. Now, what I will also say, as somebody who is on the other side, is that it is still incumbent upon you to go and be consistent. You can ask for all the help in the world, but ultimately the help is for you to do something. So yes, there are services that are there to educate and to prop up any gaps or to plug any holes that may be there, whether it's psychologically or from a social work standpoint or a nutritional standpoint, and finding services that are there. We are in the best technological age, I mean, that's an obvious statement, ever before. Use Google or Bing or whatever you use. Use it, find it. If you have social media, I'm going to look into the camera. If you have social media, you have the internet. Use it. Use it properly. Don't ask your friend. There are experts here. There's Psychology Today as a website. There's the Mecklenburg County website. There's so many things that you can use to find resources. And people work really, really hard to make these things user-friendly. They really do. Like, people get paid a lot of money to make these web portals or these websites accessible to as many people as possible. But they can't make you go. So if you feel that is something, then take that view of a mandated reporter. Mandate that for yourself or a loved one to say, I owe it to myself to be able to pull out my phone or get on the internet or go to wherever hotspot, at Starbucks or whatever, and to be able to take 20 seconds to 5 minutes out of my day to find something that could be transformational for me and my loved ones, because that's how much I care. We ask too much for people to come to us, and we have to meet them in the middle. So I would say, yes, there are quite a few resources out there, but it's still incumbent upon the individual and their loved ones to be assertive enough, as we were talking about earlier, to use the resources available to get the help that you need.
So are there other comments?
Yeah, I guess I'll just jump in there. So like you said, being able to utilize Google. If you go to Google and you type in Safe Alliance, It'll take you to the Safe Alliance website here in Charlotte. Under Safe Alliance, there are multiple resources that are housed under that umbrella. You can get resources from help if you're a victim of domestic violence, get hospital bills that they can take care of it for you, or at least part of it. You have resources with a protective order, and by the way, you don't need a police report to get a protective order, or what's called a 50B. And you also have a whole host of resources under cmpd.org, where if you're curious about something, you just want to have something at the push of a button, go to that website and you'll be able to find exactly what you need. There's tons of resources. It's just about kind of knowing what to look for, having a general north to go to, and then going to where you need to go.
Yes, I will add that, and it's a shameless plug, Teen Health Connection also has very good therapists and counselors there. But also Pat's Place Child Advocacy Center has the Helping Center, where they are seeing younger kids as well for therapy.
So the word is to be committed and to use the internet to find all of the resources that are available, and there are quite a few. We have about 5 minutes left with questions, and I have 5 questions. But I'm going to ask Mr. Richard these 2 questions together.
Okay.
The first one is, why is mental health such a stigma in the Black community? Why do the Black community prefer to suffer in silence? That's one piece. The other piece that I think is similar is, why is it that the African American community uses the word crazy when describing mental health?
I'll go backwards. We tend to use the word crazy because we can't find a better term to use to describe what we're seeing in front of us. We don't have any context. Language and words that we use are there to give context to what we are observing, what our senses are telling us. That's an education thing. So yes, we use the word crazy as kind of a colloquial term that it might mean delusions or hallucinations or something like that. Or, but there are clinical terms that can be used to better and more accurately describe signs and symptoms that you may be seeing in someone else or in yourself. So that's what I would say. It's a colloquial term, and quite frankly, we tend not to challenge each other on that notion. I think kind of, in a broader spectrum, yes, we tend to be a little bit more politically correct about some of the language we use, but part of our culture is sometimes to hold on to things that may not necessarily be useful for us at this point in time. Can you ask the first question again, because I want to make sure
Yes.
I answer
Why
that.
is mental health such a stigma in the Black community? Why do the Black community prefer to suffer in silence?
Whew. Okay, might as well ask me to fix racism. I'll try to answer this as succinctly as I can. Why do we, as an African American community, suffer in silence? Well, going back to slavery times, it's not like we were taught how to thrive as a people. We were taught simply to survive. And a lot of times survival is through silence. That's why there's increased cases of domestic violence and child abuse within the African American community. We are really good at protecting ourselves even to our own detriment. So as such, if you're entrusting a healthcare provider, and I'm sure the doctors can speak on this and the detective can as well, that is representative of healthcare, period. But specific to therapy, there's a vulnerability that is needed in order for it to work, for it to stick. And we, as a people, generationally speaking, have been taught and been molded to not be vulnerable. That vulnerability is something that is a dirty word, and that you're essentially basically naked and somebody's going to take advantage of you. That there's some manipulative entity out there that is going to run rampant over one's said vulnerability, because we don't describe what that is. So I would say that first, again, there's more black people going to therapy than ever before. I think that myth is decreasing, just like the myth of single-parent homes in black communities, which statistically just is not true compared to other races. But we use as tropes to perpetuate, and it's big business, to be quite honest. It's big business for us to perpetuate these things. We look at statistics, but with any statistical measure, tests have to be adapted over time to adjust to the changing circumstances. We use old models and say old data, then we'll continue to use those tropes. So we have to use the education and what we're trying to do as a populace to get a more accurate understanding, so that when somebody is coming to me and asking to be vulnerable, not only will I have an understanding of their specific subculture, because black people are not a monolith, but also to say, I can trust in you to do that. So the last thing I'll say is that we also need more providers of color. That's what we need, specifically black providers, right? I mean, an Indian person won't necessarily understand my plight just because they're brown. We need people who look like us to be part of this. And there's a vulnerability that comes from a therapist perspective, or any healthcare provider, to be able to provide care for our people. So it goes on both sides. It's coming upon us on our field to have more inclusion and to really say that this is a viable career versus something that is akin to social work, and you might make $45,000 a year and you're like, yo, man, I can't take somebody out on a date with that. Versus, we don't have to split the difference of being either this noble, altruistic person or just getting bread. And that's kind of how we see it, that the MDs, those are the ones that make the money. The social workers and the teachers, those are the ones that they're doing God's work, and they're just trying to, go out there and make this 45. And it's like, no, we have to, again, educating the populace is about understanding not just mental health, but all the aspects that come with that, from you walking in the door, you making that first initial phone call and taking that risk. You cannot do anything that is worthwhile without taking it. But I need to make sure on my end that when you do, I'll handle that with care.
Thank you. Our last question for the evening ends with a COVID-19 question. We started that way and we're ending that way. And here's the question. How are we as a community providing aid to the homeless to prevent the spread of the virus?
Excuse me. So since the beginning of the pandemic, the Mecklenburg County, in partnership with the city's emergency management services, has been providing extensive services to those of us who are experiencing homelessness in our community, or housing insecurity. And so as a result of significant investment by the county, we have, from several months ago, secured a number of facilities, specifically hotels in the county. We have hotels that serve two functions. The first of those is to, one, either house individuals who are experiencing homelessness without shelter, so they're on the streets. So we call that, these are for people who don't have COVID-19 or symptoms of COVID-19. We have a number of those facilities across the county that we are housing individuals who are, again, unsheltered, don't have secure home housing. Or individuals who are living in shelters, congregate shelters, to move them out of those shelters to create more space so that those shelters can have adequate social distancing and separation within those facilities. So we're trying to minimize the population within those congregate living settings by moving those individuals into these hotel properties where we have leased essentially to house individuals and minimize the risk of spread within those congregate living settings, specifically shelters. You don't see it, but county staff are working day in and day out, 24/7 a day, to operate those hotels. And let me just give a shameless shout out, and not really shameless, proud shout out to those individuals who every day are working tirelessly to provide services and care, not just the shelter, but the food that goes along with it, the medical supports, all the additional supportive services those individuals may need while they're experiencing homelessness. The second set of hotels that we have are dedicated to individuals who are either have COVID-19 or they are potentially have COVID-19 and they need to isolate or quarantine, and they don't have any place to be able to do that. And that could include isolation and quarantine within their own home. For example, if they live in a one-bedroom or a studio apartment with 3 other people and they can't quarantine or isolate in that space, then they can come and stay in the hotel. And again, there are a number of staff working 24/7 to operate these hotels. The county is doing all the operations from full service security to cleaning, et cetera. And so shout out to the civil servants who are working really hard in those spaces. There are a number of other measures we've been taking to coordinate directly from a disease control, infection control perspective with those shelters to ensure they have infection control plans. They have strategies of how they will respond when a person in that shelter has symptoms. We've had some individuals within shelters who've had COVID-19 symptoms or tested positive and had to isolate and quarantine large numbers of people from those facilities and actually help walk them through the response from point A to point B. And so we're working very closely with them to do that. The last thing I'll say is we also installed a number of porta-johns and hand washing stations in areas where we know individuals who are experiencing homelessness that are not sheltered are congregating in our community. And so we wanted to make sure that while they are in the public settings, they're able to, one, use the restroom safely. As we know, a number of facilities that they may have used previously are now closed. So we wanted to make sure there was space for them to use the restroom and also be able to wash their hands. And the last thing I'll say is we've been working with some of our key community partners to ensure that those individuals who are unsheltered and do not want to or are unable to go into shelter are able to go in and take a shower and do laundry and things during certain hours of the day and extended those hours so that they're available to folks. So we have been doing everything possible to support that community. It's, of course, very tough work, and no one should be experiencing homelessness, and so we are continuing to work on longer-term solutions for what really address the root cause of why we having to do all this stuff in the interim to protect them from COVID-19.
Thank you. The Bible tells us that to whom much is given, much is required. And I want to thank the panelists for their expertise in providing us with not only data, resources, but also practical ways that we can cope during this pandemic time. I would now invite each panelist and give you 1 minute to make a final comment. And I'll start with Dr. Washington and go around.
Yeah, I'll just say, a word of encouragement to everybody. I'm an epidemiologist and I've trained my entire life to respond to epidemics and pandemics. And these are certainly tough times for even me. And so we're all human and we all have, this is stressful. It's financially stressful, it's emotionally stressful. So just be encouraged. Lean on those that are around you, love those that are, check on people who are living by themselves or living with others and are stressed in this time. And this will certainly continue. You'll see on the TV that and the news sites that the numbers and cases will keep rising. We expect that to happen. It's supposed to happen because of the way we don't have a fix for the virus just yet. But don't be discouraged and know that things might look worse at some point, but at some point we'll get better and we'll all get through this.
Mr. Risher.
Yes. I would say to the public out there that COVID-19 is a good representation of what we in the Black community need to do. This attacks our immune system, and it attacks the people who have weaker immune systems. They have a higher probability of more severe symptoms or even death. And just like that, as an allegory to our mental health, that if we don't take care of ourselves through the active process of continuing to take care of ourselves and our loved ones, it may not physically hurt you, but it will psychologically hurt you. Use this as an opportunity to be educated and illuminate some things that have been deep-seated, that have given us a higher incidence rates of contracting because of economic and health disparities. All of these things that we are trying to do up here today is to educate you so that you can be a more informed person, so that you can take action and make something of whatever this deplorable situation is, to make it better. That's what we're trying to do. We're trying to educate you, not because we want to sit up here and basically talk about how our credentials are something that where you should just command our attention. We're giving you this information so that you can take this and do something with it. So I call upon all people to act.
Dr. Jeff Coate?
I think my closing remarks are going to include our children need us, and they especially need us during this time. The pandemic is taking them more into hiding, where they are not being able to be seen visually, heard, cared for, like they need to be cared for. We are going to come out of this okay, but unfortunately, I think our job is going to increase because we're going to have more people with anxiety and mental health disturbances, more child abuse issues, more domestic violence that are going to come out of this. And we're here to take care of them. Please be a mandated reporter. If you see it, if you suspect it, call it. And the number that you can call is 980-31-HELPS, HELPS, 980-31-HELPS. You may help a child. You may save that child's life.
Detective Hibbler.
Yes. So what comes to mind would be a simple phrase: be courageous. And courage looks different on both sides of the aisle. On one side, it's the person that's in the middle of a horrific situation where they loved or they do love a person, but they know that situation is not good for them. The other side of that aisle is the person that knows of the person that's being assaulted, abused, physically, mentally, in all aspects, and they may be afraid for any kind of repercussions on their end. I would say be courageous in that seek people out, get your community together, and you don't have to do it alone. I know it could be difficult to call 911 because just the world we live in, uncertainty, but do it. Reach out to folks, especially people that you are really close to. It's really important that during this time that we don't stay isolated. So that's what I would leave with, is just be courageous. That way the cycle of violence can be broken and that you can live a life of health and love, and you can go to the next step.
Thank you, Detective Hibbler, Dr. Jeff Coate, Mr. Risher, and Dr. Washington. And of course, you, our audience, for your questions. I will turn it back to our host, Brian Morgan.
Thank you all, panelists and moderator David Sanders, for a great program, which I think was sorely needed in the community. So thank you all. Thank the audience for all of the Facebook Live questions we received tonight. We had so many coming in. We were trying to manage and get to as many of them as possible. So thank you for that. And we'll continue to think about events like this so we could continue to have conversations with the community. And sorry we couldn't get to all the questions, but we will continue to think about events like this where it's important to have these discussions, especially in this time of coronavirus and COVID-19. You know, there's a lot for us to consider as we continue to socially distance and protect ourselves from the coronavirus and COVID-19. In closing, what I'll say is please pass along to family and friends this Facebook Live event. It'll be out on Facebook Live. Just go to the Queen City Omega's Facebook page. So it'll be here for anyone to just go on and watch the entire program. So please send them out if they have not seen the program already or they watch a portion of it. It will be out there. Once again, thanks to our community partners, Mental Health Americas. Again, you can text MHA 40 at 71777. Text MHA 40 at 71777 to donate to Mental Health Americas. The funds are sorely needed for them to help in the community. Thank you for C.W. Williams Community Health Center as a partner, V101.9 FM, and thank the radio station for the advertisements that have been playing on the radio for the last 5 or 6 days. East Stonewall AME Zion Church and the Life Center that we're in right now. And then especially MGR Video Pro, Brother Mike Rogers with the Pi Phi chapter who has managed this. And if you've watched this on Facebook Live, has looked like a great event through the entire evening. And Brother Kevin Wardlaw with WCNC, who has spent time filming this entire event for us this evening and making sure it has come across how it should. Lastly, just continue to practice social distancing, wash your hands. Everything that the CDC and the state of North Carolina has told us about the coronavirus and COVID-19, let's continue to do that and keep ourselves safe. So to end, good night, be healthy and be safe, and we're looking forward to the next event with the Queen City Omegas. Thanks. Thank you. Thanks.